Our speaker is Matt Baker, the Regional Director of the U.S. Department of Health and Human Services for Region 3. Prior to HHS, Matt served in the Pennsylvania House of Representatives for 25 years. He has several friends in the audience that also served in the House, and was the Majority Chair of the House Health Committee. Matt was appointed to his current role by the White House in February of 2018. And as a presidential appointee, Matt provides executive leadership as the primary representative for the Secretary of Health and Human Services. Director Baker's office is responsible for Delaware, Pennsylvania, Maryland, Virginia, West Virginia, District of Columbia, as well as 7 recognized Native American tribes. Matt will provide a brief overview of the U.S. Department of Health and Human Services and the role of Office of the Regional Director. Additionally, Matt will provide an overview of the current opioid crisis, which is the deadliest drug crisis in American history. Overdoses fueled by opioids are the leading cause of death for Americans under the age of 50. All you have to do is look through our papers and you will see, unfortunately, lots of younger people passing, and it's not hard to understand the why when you see not one more listed at the bottom. Killing people at a rate that exceeds the loss of life to guns, to car accidents, and doing so at a pace faster than the HIV epidemic at its peak. It's estimated that 700,000 individuals have died from drug overdose since the opioid misuse began. Between 1999 through 2017, 400,000 of the 700,000 drug overdose deaths were opioid related. Further, that percentage has continued to climb over that time frame to close to now representing 70% of all drug deaths, 6 times higher than it was in 1999. Sadly, an average of 130 Americans die every single day from opioid overdoses. Matt will further refine the numbers for Pennsylvania and nationwide, as well as provide an overview of the federal response to the opioid epidemic and share some successes that has helped make the combating the epidemic. Matt currently resides in Wellsboro, Tioga County with his wife Brenda, where he is a member of the Wellsburg Rotary Club for the past 33 years. Rotarians and guests, please warmly welcome fellow Rotarian and Regional Director of the U.S. Department of Health and Human Services for Region 3, Matt Baker.
Thank you very much, Mike. I really appreciate that very kind and gracious introduction. And I was so excited to be here. I've been hearing about the 25th largest Rotary Club in the world for a long time, and as a 33-year member of the Wellsboro Rotary Club and a Paul Harris Fellow, I couldn't wait to be here. Last week I spoke at the Harrisburg Rotary Club. That's a pretty good sized club. There's maybe 125, 150 people there. But are you the largest in America? No. But in Pennsylvania, right?
Yes.
Okay. Well, I got that right. When I report to the secretary, I want to get my facts right. But before I get started, and thank you again, Mike and Mr. President, for allowing me to be here and share a few minutes with you. I do want to recognize your state senator, Kristen Hill Phillips. She served with distinction in the House of Representatives with me and on the Health Committee, and now as a state senator is one of your very own members here in the Rotary Club, and you're very fortunate and blessed to have her as a member and as a friend and a supporter. And of course, Bev McElrath, she was a former member as well, and former secretary, cabinet secretary, and so there is life after the House of Representatives. Some of us do move on to other things, and but I will tell you, the federal world is very different than the state world. It's a lot more travel and a bit more hectic at times. But also, Ann Druck, Ann Druck's aunt moved away. She was a member here, and now she's a member of our Wellsboro Rotary Club. And I met a half a dozen other folks here. I'm taking up all my time now, but it felt like a reunion coming here. So I can tell you one thing: if I ever lived in New York, I'd be a member of your club. That's for sure. But let me begin, since I know you're on a tight schedule. As was mentioned, I'm the director of HHS, and let me get this working. And I have 5 states and DC, so I do travel a fair amount. In any given week, I could be in all 5 states. I could be in DC. I could just be in Pennsylvania. Pennsylvania being the largest state with the largest population, obviously. This is a bit difficult to see, but this is the structure of the U.S. Department of Health and Human Services. And the Secretary Azar is our secretary, good Harvard man, Deputy Secretary Eric Hargan. This is the office that I work out of for the secretary. As was mentioned, I am his direct representative and ambassador, if you will, for the 5 states and the District of Columbia. And this is our structure. And what you're looking at here, ladies and gentlemen, is the largest U.S. federal branch of government in America. This has a budget of $1.3 trillion. It operates over 300 programs. And obviously, the lion's share of that budget goes through CMS, your Medicare, Medicaid programs, waiver programs, so on. Bev knows all about those as the former Pennsylvania secretary. And of course, SAMHSA, down here, SAMHSA is the organization where we pushed out $2 billion in opioid-related grants, and we, this last budget was well received to get that money. And in the proposed budget that was just presented by the President on Monday, there's $4.7 billion proposed to advance the response to the opioid epidemic. Now, obviously, it's a proposal. It's up to Congress to actually pass and appropriate, so we have to wait and see what actually will result from that proposal. These are our major operational divisions of HHS. And again, I do have to mention CDC in particular. CDC is led by Dr. Redfield. I've traveled with him extensively, and he has done a lot of research and good work in immunology. And he particularly praises Rotary at a lot of his functions. In fact, when you earlier last year had your annual Rotary report, he was the guest speaker. And he gave a tremendous shout out to Rotary and Rotary International for essentially eradicating polio. There's 12 or 13 cases, obviously, that was reported this last year. But I could just give a program on the great accomplishments of Rotary working with the World Health Organization, working with HHS and other federal and international partners. But it is a great story that needs to be told more often, the great accomplishments that Rotary, along with federal and international partners, have accomplished to almost eradicate a very, very devastating disease. The opioid epidemic by the numbers, as you mentioned, was mentioned, over 130 every day. I heard someone say here earlier that you just had 5 deaths this past week here in the New York area, and it touches everybody's lives. 3 points on this slide. 11.4 million people misuse prescription opioids, 2 million of them for the first time. 886,000 people used heroin, 81,000 of them for the first time. But obviously the 130 people that pass away every single day due to the opioid epidemic. And this was the most recent data that we received from the CDC from 2016 and 2017 data. As I mentioned, it touches everyone either directly or indirectly. This, by the way, is Secretary Azar of the U.S. Department of Health and Human Services. So let's talk a little bit about the scope of the epidemic. So what is an opioid? A chemical that can help relieve pain by interacting with the body and reducing the intensity of pain signals and feelings of pain. These are the types of opioids: legal prescription medications such as oxycodone, OxyContin, hydrocodone, Vicodin, morphine, and others, and then the illegal drugs, heroin, illicitly synthetic opioids like fentanyl, and analogs like carfentanil, particularly deadly. So this is a pie chart, if you will, of the source where pain relievers were obtained for most recent misuse. And we won't get into every single one of those pieces, but what I did want to mention, interestingly, only 5.7% of the pain relievers were obtained from a drug dealer. 36% received their opioid from a doctor or multiple doctors through doctor shopping, for instance. Over half obtained the opioids from a friend or relative. This is very instructive to us, which tells us that education is so important in this battle, as well as the disposal of unused opioids. What am I talking about? One simple thing that you can do is keep an eye on them. You have friends over, you have kids, grandkids over, they have parties, they have events at the house. Make sure if you have opioids or medications in the medicine cabinet that those are secured, put away, locked up. When we're told through the data that over half of the opioids are obtained this way through friends and relatives, it's a concern. And more education needs to get out there about how deadly, costly, addictive, and unfortunately we don't have a lot of time to get into a lot of the social determinants that lead people down this road. I really love the comment. I think it was Alex that said the comment about living a purpose-driven life. That's, some of these folks don't have that purpose-driven meaning in their lives, so they look to medication, to drugs for their escape or fulfillment. It's just one of many, many social determinants and factors. There's a lot of mental health issues involved in combating this issue as well. This is a heat map, estimated age-adjusted death rates for drug poisoning. You can see what it was in 2006 and what it is now. The last data heat chart, 2016, it's been an explosion of drugs across the country. And unfortunately, of the 5 states and DC that I represent, we are, I have my hands full on this issue. And this is just one of hundreds of issues that we work with, but it is one of the top 4 priorities of the Secretary of Health and Human Services, as is the President dealing with the drug opioid crisis. As you can see, West Virginia per capita per 100,000. We spent a lot of time in West Virginia with the Deputy Secretary, CDC Director, and others, even the First Lady. We were visiting the Lily's place. But West Virginia has a particular problem. Only 1.8 million people, but per capita they have a very, very serious problem in West Virginia. Ohio, Pennsylvania, District of Columbia, Delaware, Maryland, they're all in Region 3. And then the total overdose deaths, Pennsylvania has the ignominious distinction of leading the entire nation in total overdose deaths. Pennsylvania. Ohio next, Florida, California, New York, top 5. Drug overdose deaths, 1970 to 2015. You can see the trend lines, very, very disturbing. The abuse spikes, misuse of heroin in the 70s, and cocaine in particular in the 80s, and deaths from the opioid epidemic are unprecedented. And obviously the big driver in the spikes of recent years are the opioid analogs, fentanyl and carfentanil. Here's the three waves of the rise in the opioid overdose deaths. As you can see, over time. This is a startling chart. More people have died from drug overdoses than in all four of the major 20th century U.S. wars. How many veterans are in the crowd? That's very, very, very troubling. Too many veterans died in these wars, obviously, but look how many more have died from drug overdoses. Startling. Startling. And this gives you a perspective of the lethality of heroin, fentanyl, and carfentanil. This is the dosage that can kill you. Heroin, fentanyl, and carfentanil. One little speck of carfentanil. Pretty serious. And when opioids and other drugs are laced with these kinds of drugs, it becomes very, very problematic and difficult to deal with. I'm glad we have some doctors in the room. I'm glad, looking forward maybe to interacting with him and your opioid collaborative at some future time. Glad for all the efforts that are being made to address this issue. Synthetic opioid deaths closely linked to illicit fentanyl. Here's another trend line and time frame. I'm going to try to keep moving. So HHS has a 5-point strategy, essentially, although this is not all-inclusive. The first one is better addiction, prevention, treatment, and recovery services. Better data. We have to have data in order to have a good strategy and knowing what the focus should be. Better pain management. Better targeting of overdose reversing drugs, and better research. And you'll be seeing much more money being put in to addressing those 5 points on that slide. Reducing prescriptions, keep illegal opiates and heroin out of the country. A lot of activity with the Department of Justice, DEA, Homeland Security, drug interdiction. More technology is going to be deployed in post offices, in domestic ports. There's a tremendous all hands on deck across the board intra and inter-agency cooperation in order to address this issue. There's also problems, obviously, with the dark web and the internet and them coming in that way. Helping communities understand how to avoid addiction. FDA is going to become more aggressive in the future, addressing certain issues, and drug disposal. And I don't know if Rotary's ever had opportunity to sponsor a drug disposal educational effort or work with your law enforcement or your DA or your chiefs of police, but it's really a great idea to try to get the word out how people can dispose of their medications that they have in their medicine cabinet and the drop boxes that might be located. I know, I think the Department of Public Welfare, or DDAP, has a dashboard that you can actually go on here in Pennsylvania and it'll locate. There's a locator to tell you exactly where they're located. So treating addiction, save their life with naloxone, Narcan. We have a standing order here in Pennsylvania, and I think now all 50 states have a standing order. You don't need a prescription. You can go right into the pharmacist and ask for this. You still have to pay for it. But if you know a loved one, a family member, or you're around someone potentially at risk, you do not need a prescription. It's a standing order. You can go right in and get the reversal, overdose reversal medication. Second, treat their addiction with FDA-approved medication-assisted treatment. We always refer to this as MAT, naltrexone, methadone, buprenorphine, naloxone, Vivitrol, that sort of thing. All depends on the particular addiction and the need and where the person is in their recovery journey. Third, address their underlying issues with psychosocial therapies. We could get into that a lot more. We do not have time for that. Throughout, surround them with supportive recovery services to rebuild their lives. Making treatment affordable. So we've taken certain actions. We're going to be rolling out additional actions very, very soon. But here's what we've been doing. CMS, 21 states get approved for Section 1115 substance use disorder waivers, integrated care for kids model, CMS maternal opioid misuse model. I was on a phone call Monday with the special counsel and advisor to the Secretary and President from CMS about some new initiatives you'll be hearing about very, very soon. Expand the use of telemedicine. This is a broad-based area of support from both sides of the aisle and in all quarters. It definitely needs to be developed more. We still have a little bit of an issue with rural areas not having full deployment of broadband services, but we're making some headway and improvement there. We did push out $2 billion in grants, as I said earlier, that went to states from SAMHSA, HRSA. Sorry, it drove me crazy when I first got into federal service over a year ago, what all those mean, but you're going to see HRSA, your federally qualified healthcare centers, you're going to be seeing them taking a much more active role going forward on MAT and the possibilities we literally have thousands of federally qualified healthcare centers and lookalikes that could be doing more, and we're going to be challenging them to do more in the future. And of course, CDC, Center for Disease Control. Getting federal agencies to work together to fight the epidemic. Don't have time to go into all of that, but you'll see over here on the right all the various organizations within the federal government working on this. Even the Department of Justice, DEA, Homeland Security, HUD. HUD is very, very involved in this. USDA is very, very involved in this. A lot of people don't realize that there's brick and mortar grant funding through USDA to address the opioid problem. So it's an all hands on deck kind of approach that we're taking. Keep watching my watch, because in Wellsboro, if I go over, I get a heavy fine. So we have some emerging signs of progress, and here's some of the signs. We see a 26% reduction in opioids from pharmacies. I can tell you Geisinger, when I met with the former CEO president there, who's now with Google, I believe, Geisinger as a health system reduced scripts, opioid scripts, by 50% in their system. And it was pretty impressive. It really got the attention of the White House and the Secretary of Health and Human Services. And so we're always looking at good models of what people are doing so we can encourage others to emulate them. We've seen a 338% increase in naloxone, Narcan prescriptions. That's a very good trend line, obviously. We are seeing more people in Medication-assisted treatment, 22% increase. We need to improve on that. Buprenorphine and others. And a 47% increase in naltrexone. Again, good trend lines and good levels of indicators going forward. We're seeing decreasing opioid prescribing. That's a very, very good thing. Increasing naloxone dispensing. Here's a great trend line. Increasing receipt of MAT, medication-assisted treatment, in helping folks get recovery. Looking ahead as we move into 2019, we're continuing our implementation phase, instituting programs, policies that combat the opioid crisis. The HEAL initiative, that is an NIH, National Institute of Health initiative, kicking off more phases of research, considering new initiatives this year. We've looked at opioid deterrent medication, but as we all know, it just makes it harder for people to break it down into a drug. You're going to be hearing a lot more about research being done for non-addictive painkillers. Non-addictive painkillers through NIH, CDC, and the FDA. The Support Act, new mandates and program authorizations, and of course another round of funding that I mentioned earlier, which would be a record level if we're able to get Congress to pass that. That'll be a record level of federal funding. And when you combine that with what the states are doing, the counties are doing, and the local communities are doing, the philanthropic organizations are doing, coming alongside, working together to address this crisis, it will make a difference. So, the opioid epidemic continues to evolve. Synthetics are causing the current spikes, as I mentioned. Fentanyl, carfentanil. Other areas seeing methadone as a major issue, but it's a single-digit problem with drug diversion and so on. HHS and community responses are transitioning from crisis framework into an integrated, sustainable, predictive, and resilient public health system to prevent and treat substance use disorder. And obviously, we're all challenged to come alongside and try to help this in our this problem through education and awareness within our own families and our communities. We've even engaged a lot of faith-based organizations too to help with this issue. How's that for getting under? I was told 110, and I got 2 or 3 minutes, right? No fine? Okay, good. I'm going to stop there. I went through an awful lot very, very quickly. There's actually twice as much information that I could have shared with you, but I respect the time frame of Rotary, and I'm used to it. So I'd love to come back some other time, perhaps with another program if you'd like me to, but we have time for maybe 1 or 2 questions, and then I've got to sit down. Okay. Yes, sir.
Matt, you touched on that very briefly, and I wonder if you could just expand a little bit. I had read that oxycodone and others are not necessarily the most effective pain relievers. Where are we on the process of finding other alternatives that are non-addictive?
Yeah, as I said, we are going to be working assiduously on research to find a non-addictive pain reliever that hopefully will not lead people down that path of addiction. Now, obviously, some people have more of a predisposition or proclivity toward addiction. Some people have more tolerance for medication than other folks have. But we have heard way too often that oxycodone in particular, some people, it is you know, the addiction can start within a week, very, very quickly. And I know we have some judge candidates here in the room as well, and I have a personal friend who's a judge. He blew out his knee, he got a prescription of oxycodone. Next thing you know, he's addicted. He's in a major rehab program. treatment recovery program, and it took quite a toll on his family and friends, good neighbors of mine, and unfortunately, he's still dealing with that, obviously. But we need to find alternatives, and we need doctors. We see very good signs of doctors being much more extrajudicious in what they prescribe, how much they prescribe. This cuts across not just doctors, nurse practitioners, family physicians, tertiary care, emergency room, dentists. It cuts across all venues of medications. And I would love to see it. I'm just putting in a plug for our state senator over there. You know, the District Attorneys Association came to me before I left for federal service and wanted us to regulate pain clinics. It's amazing that as we sit here today, we have no idea how many pain clinics there are in Pennsylvania. They're not licensed and they're not regulated. And yet, we have pain clinics. And I didn't know that until the District Attorneys Association came to me and said, we need legislation dealing with this issue. And so I'm hoping someone takes that up as well to address that issue. Yes, sir.
It seems to me the elephant in the room that has not even been mentioned to any degree today are the pharmaceutical companies. I sense that there is an evolving investigation going on with some of them that have just two initials on them.
Yes, sir. In fact, Purdue, which manufactures oxycontin, they're now thinking of filing for bankruptcy because of all the lawsuits that are filed against them across the country.
Pain has always been with us from time immemorial. Opioids haven't. So there's a lot behind this, and I would hope that surfaces.
Absolutely. Do we still have time to take more questions? One more question. Who wants it? Okay.
I think it was around 1971, the Nixon administration was when they launched the war on drugs, and there are prevailing opinions that the war on drugs in many ways had the unintended consequence of enabling a lot of drug issues in the United States, and I was wondering if you could speak to that paradigm.
Well, it's you know, I think it was a well-intentioned effort to address a very serious problem. We do have a serious problem. There's a tremendous level of drug trafficking, and drug trafficking connection with even human trafficking. And so everywhere you look with a lot of these issues, there are terrible victims. There are victims of crime. And we need to find an appropriate, proper approach in dealing with the issues that we're struggling with, because when we have, it's not a laughable matter when we have almost twice as many people dying as we did in those 4 major wars. So to do nothing. You know, someone once said, evil flourishes when good men and women do nothing. Well, we have to do something. And so we've got some of the best and the brightest minds in the country addressing this issue, from the criminal justice system to health and human services to every facet of the federal government, state government, county government. And yet we still see this tremendous problem with drugs. And so we have to address as well, why do people continue to demand the drugs? Why do people want to use them in record levels? And it leads to addiction and unproductive lives. I was still in high school in 1971, so I can't really say a whole lot about the history of that, but I'm being told my time is up again, so I better stop. Thank you very much, everybody.